It's like as we get older, all our bodies are slowly dying, right? So everything,
that's
I know
depressing.
that's a depressing thing to think, but that's the reality.
Yeah.
All of our senses are getting worse.
Yeah.
When you get older, your hearing gets duller. Your sense of taste and smell are not as good. Your vision is not as good. Your reactions are not as good. Your
Yeah.
nerves are
memory?
not as good. Your memory is not as good.
Your memory?
My memory was never good.
What were you saying? No.
But yeah, stop interrupting me.
Sorry.
No one was talking about. Anyway, but everything is getting duller.
Yeah.
Right? I would say young people, because they're still vibrant and all of their nerves and their feedback mechanisms are healthy.
More reactive.
Yeah. It's funny because, like, speaking of that, right? We'd be at, when I was at the Army hospital, I've got these big young guys, right?
Yeah.
Some
Fit.
cut on their hand, right? And they're just like, oh my God. And
This
thinking
is
to yourself,
men,
oh
though.
my God.
This
You're
is
like, oh my
men.
God.
Men
No, but
just
I
so
think,
baby.
I think there is some truth to that. So the other thing that I tell people is like, if you took a young guy, like say our age, younger, okay, maybe say 30 or 40 years old, whatever, and they fell off their bike and they broke their hip, just laying in bed, they would be in agony. Like you cannot give them enough pain medications to cool the pain. An 87-year-old demented lady
Yeah.
who falls down and breaks her hip can be lying in bed and have no idea she broke her hip. As long as you don't move her. Once you move her and the
Then
bones
you
move,
saw.
then it's like then they wince and they're obviously in pain.
Yeah, that's
but then
true.
if you leave them alone, they don't even need any pain meds. They have very, very little pain.
Oh, you can hear the dog snoring.
And that's a function of, I think, just the nerves are just not as good.
Not
so
as good.
I would agree, younger patients are harder to rehab.
And do you feel like women too are faster, or it doesn't really matter?
I don't know if that matters. I think in terms of pain tolerance, what I've noticed is the older Asian woman
There it is again, the older
tends
Asian
to
woman.
deal with the pain the best. I don't know if it's purely a cultural thing where they, especially say in the Japanese
Yep.
culture, right? Like it's a little bit dishonorable or shame to complain. So they just bite the bullet,
Yeah.
and but
But that's not true for all Asian women, because there are definitely obviously subcategories, right, of Asian that tend to be more demonstrative,
true,
right?
true.
Yeah.
Do you find like pain or anticipated pain with physical therapy is a barrier to why people won't go to physical therapy after having a surgery? Like, does physical therapy make the pain worse?
Yes, sometimes.
Yeah.
So
it
I'm wondering if
depends.
people are hesitant to go.
Well,
If-
I just had
I don't know if that makes sense.
no, it does. And I think that's why going to a therapist that's very, not intuitive, but a therapist that really is thinking about the physiology of what's going on is very important. Like
Like a specialized.
or somebody who just thinks more and also is spending one-on-one time with the patient.
That's probably
Unfortunately, there
important.
are some people that go to outpatient therapy and they just get put on a bike and they just get told to ride the bike for 20 minutes and then
Oh.
they don't really have so I don't like that. Like that's why I tend to be a little bit more particular about where my patients go for physical therapy, just
Got it.
because I just through experience I kind of know like okay, these groups do really take care of our patients really well, and I don't get patients coming back complaining.
Yeah.
But the other thing that is true is over aggressive therapy is not good because it just causes, like I just had a guy come back to the ER who was doing great. And then he said he went to a therapist and the therapist, he's screaming and he said the therapist just said, I got to get your knee to the bend this much. Like sometimes a younger therapist or an inexperienced therapist
Yeah.
think my job is to get your knee to bend to 120 degrees. But I mean, that'd be nice, but not everybody is going to get there. And if you crank on somebody's knee 2 weeks after surgery, you're just going to cause more inflammation and swelling.
Yeah.
Now their therapy is even harder. So there's a
Right.
balance, right, Chip? Would you agree between pushing a person and not causing too much pain and right? Maybe talk about that a little bit.
That's absolutely true. we found out that there's no need to crank on people's knees